The first thing that you should do if you have COVID-like symptoms is to isolate yourself, both for the safety of society at large and for your own safety. And by isolation, I mean getting into a room with an attached bathroom, washroom, where you can look after yourself completely. Subsequent to isolation, you should get all your routine investigations done. The most important test that you should do is the RT-PCR, the reverse transcriptase polymerase chain reaction, to detect the COVID virus. Subsequently, you need to do some investigations to find out the intensity of the infection. So perhaps your doctor would recommend that you do a complete blood count, a CRP, and in interleukin 6, a D-dimer, fibrinogen, etc. These will tell you whether you're going to develop complications, how far you have gone in the disease. Ideally, you should also get a high-resolution CT scan of the chest done. Unfortunately, that means that you'll have to travel out of the house. Now, that, of course, becomes a big problem. In the interim that you're waiting for your RT-PCR report, what you should do is, if you have a fever, you can take paracetamol. Paracetamol comes as crocin, Dolo, Lanol, anything. And you can take up to 1,000 to 1,500 milligrams in 24 hours. If you are getting a bad cough, you can take a cough suppressant, any cough syrup. However, if it is a wet cough and you're bringing out yellowish phlegm, then it is better to start an antibiotic after the advice of your doctor. Other than that, there's nothing. You should keep yourself hydrated absolutely properly. Take proper nutrition. There is no contraindication to eating or drinking anything except alcohol. No alcohol and no smoking. Sometimes it becomes a bit of a fetish. If you keep a pulse oximeter at home, people are constantly checking it out. And these small pulse oximeters are extremely fallible. 2 pulse oximeters will give you different readings. And you can't afford the big ones, which we use in hospital, which cost about 50,000 to a lakh of rupees. Those are sophisticated ones. But so far as to go, you can use it. Your oxygenation should remain ideally over 91, 92%, 93% breathing room air. When you're sitting in the room like this, breathing, your oximeter reading should be a minimum of 91 to 93%. Anything below 91 and 93%, you require medical attention. If it's a one-off thing, you check it now and half an hour later it's normal, it really doesn't matter. But if it's consistently at that level, you require medical attention. Well, ideally speaking, you should have a pulse oximeter, no matter how fallible it is. If you don't, if you start feeling breathless, you know, I'm here like this and I have COVID. If I start breathing like this, that means that I need to be careful, okay? Or if I speak like this. Okay, so we can do that. I don't know what to do. When I'm speaking like this, that means that I'm breathless. The other person can immediately make out you're breathless. Under these circumstances, you must seek medical advice. If your saturation persistently goes below 91, 92, etc., persistently, you need to start looking for a hospital bed. If you have a very bad fever, which doesn't come down despite crocin for more than 24 hours, you need to look for a hospital. If you have a severe backache, bone pains, and they are just not getting better with your paracetamol, you need to ask for hospitalization. If you cough out blood, you need to ask for hospitalization. Then what happens is, if you wait too long, you know, if you dilly-dally, then some patients become serious. And by the time they present to us, they are ICU cases. And beds are scarce to get. And ICU beds are extremely difficult to get. I really don't think that there are any other medications that the family member needs to take. Previously, we used to talk about HCQS, etc. I don't think that's necessary for anybody. Immune busters, you just take a normal nutritious diet. That's important. But you need to stay away from the infected person. You see, the vessels, the food that he eats in, preferably should be in a disposable container. So when you pick up the containers wearing gloves, dispose them off in a black bag and then take it to the nearest biodisposable facility which may be there. Otherwise, I don't think there's anything. The clothes can again be picked up in a different basket and washed separately in the washing machine. The detergent will take care of the virus. Not really, but it gives you symptomatic relief. You know, the virus actually enters through the nose or through the oral cavity because it's airborne. And the first symptoms that you get is a little stuffy nose, irritation in the throat. So when you take steam, it helps you. There is no proven efficacy of it killing or, shall we say, preventing the virus from infecting you. It gives you symptomatic relief, whether it is the patient or whether it is the relatives who are around. I would strongly recommend double masking in this sort of a situation for the patient, and if any relative tends to go near the door or something. The mask inside should be the triple ply mask that we normally use, the blue mask, and you can have a cloth mask above that, a tight fitting cloth mask. Actually, the patient or the relatives really do not require the N95 masks. The N95 masks are worn by us because we are in constant touch with the patients. And if I am in a room with a COVID positive patient, then for more than 6 minutes, the chances are that I will inhale. There I need something which is very tightly fitting all around. And that an N95 does. For these sort of patients, absolutely a 4-ply or a 3-ply mask with a cloth mask on top is more than sufficient.